When you enter your 60s, something begins to change in your body quietly and unnoticed. You take a step and feel like your foot doesn't fully land on the ground. You hesitate for a moment while going down the stairs. And slowly, without realizing it, your self-confidence begins to decrease. Now let's face a fact that will surprise you. A 2021 study by the University of Oregon revealed that more than 40% of individuals over the age of 65 live for years without noticing the first signs of deterioration in their balance system. During this process, the hip and ankle muscles weaken rapidly. The small muscle groups responsible for maintaining balance lose their function, and the risk of falling increases. But here's the good news. The same study also showed that movements performed just a few times a week can reverse this deterioration. Today, I will share with you a 5-step chair program that I teach my own patients. It requires no equipment, and there is no need to go to the gym. Just a chair in 5 minutes. Before we begin, it is important to understand why it works. Most people associate balance problems with aging and accept it as, that's just how it is now. But that's not entirely true. Balance is the result of communication between your central nervous system and your muscles. When this communication weakens, problems begin. And this communication can be strengthened again with the right movements. A 2019 study by the University of Pittsburgh found that individuals over the age of 70 who practice seated balance exercises 3 times a week showed a 42% improvement in walking safety and a 38% reduction in fall risk within 8 weeks. No medication, no surgery, just a few movements. Exercise 1. Seated toe raises ankle stabilizer. Most people think balance problems originate from the hips or knees. However, a 2020 study by Northwestern University showed that ankle proprioception, the body's ability to sense its own position, can decrease by up to 30% after the age of 60. This loss disrupts ground perception and silently increases the risk of falling. Muscles used: tibialis anterior, front shin muscle, and the small muscles that stabilize the ankle joint. These muscles allow you to maintain balance by sensing the ground. They're the system that reacts first when you trip or slip while walking. How to do it? Sit upright in your chair with your back not resting against it. Place your feet flat on the ground with your knees at a 90-degree angle. Now, keeping your heels on the floor, lift your toes upward. Hold for 2 seconds, then slowly lower them over 3 seconds. Do 10 to 12 repetitions. Rest for 15 seconds and complete 2 more sets. For an advanced level, place a folded towel under your heels. This small change challenges the muscles more. This movement increases ankle muscle activation and strengthens the signals your body receives from the ground. It supports more stable walking. It helps you step safely on uneven surfaces, reduces morning stiffness, and relieves ankle fatigue. Exercise 2. Seated knee curl hamstring strengthener. Most people focus on the front thigh muscles, the quadriceps, when trying to strengthen their legs. However, a 2022 study by the University of Cincinnati revealed that hamstring, back thigh muscle, weakness is one of the most common causes of knee instability in individuals over the age of 60. Muscles used: biceps femoris and semimembranosus, hamstring muscle group, and the popliteal area behind the knee. These muscles allow you to step backward while walking and maintain control when going downstairs. When they weaken, the knee begins to collapse forward, leading to tripping and an unsteady gait. How to do it? Sit on your chair with your feet flat on the ground. Now extend one leg forward, then slowly curl it back as if pulling your heel under the chair. Curl in 3 seconds, hold for 2 seconds, and return in 3 seconds. Perform 10 repetitions for each leg and complete 2 sets. For an advanced level, you can attach a light ankle weight. This exercise allows the knee joint to move in a controlled manner in both directions and speeds up reflex responses during a potential fall. It helps improve confidence when going downstairs, promotes a more balanced walking pattern, and reduces stiffness and pain behind the knee. Exercise 3. Seated side leg. Raise hip abductor activation. Lateral balance, the ability to prevent the body from swaying side to side, is one of the most critical and most overlooked functions in older age. A 2021 study by Boston Medical Center showed that hip abductor weakness is directly associated with falls in 57% of individuals over the age of 65. Muscles used: gluteus medius and tensor fasciae lati, outer hip muscles. These muscles prevent your pelvis from tilting to one side with each step while walking. When they weaken, walking becomes unstable and swaying increases, dramatically raising the risk of falling. How to do it? Sit upright and place your hands on your knees. Slowly move one leg out to the side, keeping your foot sliding along the floor. Move out in 3 seconds, hold for 2 seconds, and return in 3 seconds. Perform 10 repetitions for each leg and complete 2 sets. For an advanced level, hold the position for 5 seconds at the peak of the movement. Activating the lateral balance muscles improves the body's response to instability and increases pelvic stability. It helps with safe walking in narrow spaces, maintaining balance during sudden turns, and improving the ability to stand on one leg. Exercise 4. Seated trunk rotation, rotational balance activator. Most falls do not occur forward or backward, but while turning or looking behind. A 2020 study by Johns Hopkins revealed that the contribution of weakened trunk rotation muscles to balance disorders doubles with age. Muscles used: obliquus externus and internus abdominis, side abdominal muscles, and the thoracic spine supporting muscles. These muscles control your body when reaching for something, turning back, or opening a door. When they weaken, balance loss occurs during sudden turns. How to do it? Sit upright in your chair and cross your arms over your chest. Slowly rotate to the right, hold for 2 seconds, then return to the center. Then rotate to the left. Perform this 10 times in each direction and complete 2 sets. For an advanced level, extend your arms straight out at shoulder height while rotating. Trunk rotation retrains the body's center of balance and strengthens reflex responses to sudden changes in position. It helps improve confidence when looking behind, enhances balance during reaching movements, and reduces tension in the lower back. Exercise 5. Controlled sit-to-stand functional strength and balance test. A comprehensive 2019 study by Harvard University identified the controlled sit-to-stand movement as one of the strongest predictors of independent living. Individuals who can perform this movement safely were 48% more likely to maintain independent living even 10 years later. Muscles used: quadriceps, glutes, hamstrings, and core. It is one of the few exercises that works the entire lower body at the same time. It plays a key role in improving the muscles needed for essential daily movements, such as getting up from a chair, car, or toilet. When this movement weakens, dependency begins. How to do it? Sit on the front edge of your chair with your feet shoulder-width apart and your toes slightly turned outward. Lean forward from your hips and shift your weight onto your feet. Slowly stand up, using your hands as little as possible. Hold for 1 second while standing. Then sit down in a controlled manner over 3 to 4 seconds. Start with 5 repetitions and increase to 10 as your strength improves. If you need hand support, definitely use it. This movement tests and improves the coordination of balance and strength systems under real-life conditions. It helps enhance independent mobility, improves confidence on stairs, makes getting up from a car or bed easier, and significantly reduces the risk of falling. You have completed these 5 exercises. In just 5 minutes, you have activated your entire balance system from your heel muscles to your hips, from your trunk to your center of balance. When you do this 3 times a week, the response your body gives will surprise you. Most people see balance problems as an inevitable part of aging and simply wait. But today, you took action. You started from your ankles, moved to your hamstrings, activated your lateral balance, engaged your trunk rotation, and finally performed the functional movement that integrates the entire system. Which of these movements appealed to you the most? Write your age and which exercise felt the best in the comment section. We read and respond to every comment. For more doctor-approved, senior-friendly exercises, subscribe to our channel and turn on notifications. Today, you took an important step. Keep going. Your balance, independence, and freedom are worth it.